What's with your red shoes?
So, my red shoes are very comfy and very functional. This is the true story, by the way. It started out that I wasn't going to pay $60 for a new pair of Vans, and then I saw, oh look, here's an orange pair for $30. And then when they wore out, I said, oh, well, let me just look in the seconds, and the seconds always have red for some reason, and I've never understood. I'm Mark Bishop. I'm a professor in the Department of Physical Therapy and Program Director of the Doctor of Physical Therapy program.
What's your favorite snack?
Corn chips with melted cheese.
Your go-to dance move?
to sit, Lindsay.
PT or OT?
PT, obviously, Lindsay.
What's your favorite animal and why?
So kangaroos, because they can't go backwards. Kangaroos always go forwards.
So you're a very well-traveled individual. You've lived in Australia, Canada, and the US. Can you share some of the cultural nuances or any differences that you've observed in each country?
One big difference that sticks out to me, strikes me a lot, is if I go to Australia, people don't really want to know what job I do or what I do at work. They say, why are you talking about work? So because that's kind of part of my identity in the United States. Most of it focuses around work, and that's a very different experience at least with the peer group with whom I'm in contact in Australia. And you can wear no shoes into a grocery store in Australia. That's perfectly legit.
Can you explain the importance of physical therapy as a pain intervention?
Well, I'm going to do one better for you, Linz, and say importance of physical therapy. So there's a great saying that I like that is, medicine gives you days to your life. Physical therapists give you life to your days. Our vision as a profession is to transform society, and we do that by kind of improving the human experience and optimizing the way you move. In that context, if pain is one of the most common reasons that people seek care from a musculoskeletal clinic or an outpatient clinic, then my role in managing your pain may be to modify the way you move, or the way a joint moves or a tissue moves, to help eliminate pain if it's a symptom of something. But pain can also be a health condition. It may be necessary to optimize how you move within the context of that pain condition. Certainly give a nod to our great colleagues in OT, that OTs focus a lot on participation, on my role, but I think PTs really do a great job focusing on proving the different systems that are involved in movement as a whole.
What's one misconception maybe about physical therapy that you would like to debunk?
That we do massage. I'm just suggesting that if you're looking to have massage done for half an hour or something like that, that you do not go to a physical therapist for that. You may find some that will do it for you, but it's not the usual intervention of choice for the whole session.
If you have to think back to the most memorable experience of your career, I know there must be a lot. If there's something that...
I'm kind of old, Lindsay, there's a lot that's gone on.
But if there's something that a student or a patient has said to you that has stuck with you.
How much time do I get to think?
You can have as much time as you want.
How about this? I had a mentor one time that said to me that I should treat what I have found, not what I thought I should have found. He said that to me in the context of patient care, but it's a research thing, it's an education thing, it kind of fits all those circumstances.
All right, so any last thoughts that you want to share, anything that you want to shamelessly plug?
For whom? Shamelessly plug for whom?
For yourself.
I think it is Mark Bishop's opinion, and I think we have some data to back up most of my opinion. We are, as a program, the UFDPT program, one of the top places in the country to train physical therapists, to train clinician scientists and to train junior faculty. I think that this is a top tier place to get those levels of training. I really do. Not even making that up. I make a lot of stuff up.
Not that one.
But not that one.